What happens when ideology overrides science in the highest levels of government? In a heated Senate hearing, Senator Raphael Warnock laid it all out for RFK Jr., holding him accountable for decisions that put children's lives at risk and undermined the CDC. This wasn't politics as usual. This was a moral reckoning, and the consequences could be deadly.
In the aftermath, Secretary Kennedy, I'm about to ask you a series of yes or no questions about the events of the past month, and I would appreciate just a yes or no response. You called Dr. Menarez to your office on August 25th for a meeting. Is that correct? Yes or no?
It could be. I just don't know the date. I'd have to check my calendar.
Was Jim O'Neill the man you just appointed as acting director of CDC in the room on whatever date you met with him, since you can't recall? Was he in the room when you met with Dr. Menarez? In that meeting, did you criticize Dr. Menarez for her statements to CDC following the shooting where she said, quote, misinformation can be dangerous?
I don't believe so. I have no recollection.
You don't believe you criticized her?
Oh, I criticized her.
Did you criticize her?
Did you criticize her? I don't even.
Did you criticize her for her statements to CDC workers following the shooting?
Did I what?
Did you demand that she fire career scientists or public experts at the CDC?
Yes.
Did you demand that she accept the recommendations of your hand-picked vaccine advisory panel without further review by career CDC scientists?
No, I did not.
You didn't ask for her commitment ahead of time that she would accept the recommendations from the advisory panel? You're denying that?
What I asked her about is she had made a statement that she was going to not sign on, and I wanted clarification about that.
Did you tell her to accept the advisory panel's recommendations?
I told her I didn't want her to have a rule that she's not going to sign on to it.
Did you say that the CDC was, quote, the most corrupt federal agency in the history of the world?
Not the history of the world, but definitely within HHS.
Did you say that?
I did not say that, but I did say it's the most corrupt agency at HHS, and maybe the government.
So you call the CDC corrupt. Did you say that CDC staff are, quote, horrible people?
Horrible people?
Did you say that they're killing children and they don't care?
No.
Okay, I think that we all have a history of listening to you and these answers. But you're on the record for a number of these statements. Despite your lack of credentials and expertise, clearly you have an agenda. It is a threat to the public health of the American people. It's clear that you are carrying out your extremist beliefs, which is why you attempted to fire Dr. Menarez.
We're the sickest people in the world.
Sir,
we're the sickest people on earth.
I'm speaking.
How am I a threat?
Secretary Kennedy, for the first time, we're seeing deaths from children from measles. We haven't seen that in 2 decades. We're seeing that under your watch. You are a hazard to the health of the American people.
Can I respond to that, Senator?
No, I claim back my time.
We need to wrap up.
You are a hazard to the health of the American people. I think that you ought to resign. And if you don't resign, the President of the United States, who put forward Operation Warp Speed, which worked, should fire you. Thank you so much.
What we just witnessed in this Senate hearing between Raphael Warnock and RFK Jr. isn't just politics. It's a study in responsibility, accountability, and the human cost of ideology when it replaces science. Warnock's questions weren't meant to humiliate, they were meant to illuminate. He pressed RFK Jr. on the decisions that have real consequences for the American people, decisions that touch lives in ways statistics alone can't capture. When you fire career scientists, when you undermine the CDC, when you ignore evidence about vaccines and public health, these aren't abstract choices. They are choices that determine whether children live or die, whether communities are protected or left vulnerable to diseases we thought we had conquered decades ago. RFK Jr. represents a tension that has become increasingly visible in our public discourse, the tension between ideology and expertise. His approach frames public health through a lens of skepticism, distrust, and personal belief rather than evidence, and that creates a dangerous vacuum in a system meant to safeguard millions of lives. When Warnock asks about whether career scientists were pressured or fired, and RFK Jr. dodges or equivocates, what we see is the operational risk of replacing facts with ideology. It's one thing to debate policy, it's another to undermine the very institutions that protect the population from preventable harm. Warnock goes further. He calls out the tangible consequences of these decisions. Measles deaths among children for the first time in 2 decades are not statistics in a spreadsheet. They are preventable tragedies directly tied to failures in leadership and adherence to evidence-based public health practices. Warnock's insistence that RFK Jr. is a hazard to the health of the American people is not hyperbole. It's a moral judgment grounded in observable consequences, one that transcends politics and enters the realm of ethics. He also highlights the pattern of selective accountability. When leaders apologize for missteps, as Chuck Schumer did, it demonstrates a recognition of responsibility. When leaders refuse to accept the same standards for their own rhetoric or decisions, it erodes trust in institutions and amplifies the very risks the institutions exist to mitigate. Warnock is pushing viewers to understand that leadership isn't about personal belief or performative bravado. It's about ensuring systems designed to protect the public function properly. The hearing also reveals a broader lesson about governance and the culture surrounding expertise. Institutions like the CDC exist not as bureaucratic obstacles, but as safeguards built on decades of knowledge, research, and rigor. Undermining them, even partially, sends ripples through the system that can have cascading effects. Public trust erodes, misinformation spreads, and diseases that were once contained gain footholds. Warnock's questioning exposes these dynamics in real time, showing the audience how political decisions, rhetoric, and personal ideology intersect to affect public health outcomes. Ultimately, this is a moment for the public to reflect on the importance of evidence-based decision-making. It's a reminder that public health is not partisan, and that the consequences of undermining scientific institutions are tangible and often tragic. The hearing illustrates how accountability, moral clarity, and courage are essential qualities in leaders who hold positions of responsibility over millions of lives. It challenges us to think about what we value in those we entrust with public safety and how ideology should never come at the cost of human life. If you want to understand the forces shaping the health and safety of the American people, this is the kind of scrutiny and analysis that matters. Like this video, share it, and subscribe to Left Lens for in-depth, humanized commentary that breaks down not just what happens, but why it matters.